Hi, we are Dr. Friends. Please like, subscribe, and comment. You know what tonsil stones are, right?
Sure, open your mouth, you see tonsils.
People with tonsil stones are really curious about how to remove tonsil stones.
I would be curious too.
Do you know how tonsil stones are usually discovered?
Usually because of bad breath or a sore throat from tonsillitis. When they go to the hospital, we can tell right away. Isn't that how many are discovered?
The most common? You suddenly sense a foreign body. You cough, something white comes out, and it smells terrible. People say, this was in my body. And then they come in.
Like a stone.
It's not really stone, like,
Feels like debris.
it's a bit like that. Since it smells, it can actually cause bad breath, so people really want to remove it. So they search for tonsil stones on YouTube or look up tonsilolithiasis or tons stones in English, and there are amazing videos of removal. They remove ones as big as a thumb.
Even non-medical folks can.
People remove them at home using their fingers and stuff. Like this.
They insert.
There
It
are
comes out.
videos like that, and after watching them, people come to the hospital thinking it should be removed like that.
Shouldn't ENTs handle removal?
Can't they be?
Tonsil stones form because tonsils should be round and smooth. However, when they get inflamed, pits develop, creating areas where stones can form. And small amounts accumulate every time we eat.
In the gaps.
Inflammation pus accumulates. When it accumulates and decays, it hardens and grows large enough to feel like something is in there. And it can cause bad breath. If you try to remove it by pressing with a cotton swab or your fingers, what do you think will happen?
More inflammation.
Exactly, it can cause inflammation. To remove it, you press around the hole to extract it. But tonsils aren't hard. Tonsils are soft, so if you poke them with something hard, it creates a new hole. This makes the hole bigger and larger things get stuck. In foreign videos, you see large ones, people removing them, because people enlarging the hole until it becomes as big as thumb. The bigger the hole, the more food gets trapped,
It decays more.
and it becomes a hassle.
Don't doctors usually remove them?
If we see that someone is really suffering, we'll remove it with suction.
Then you can get all out.
We try to use suction, but if that doesn't work, we sometimes use a cotton swab to press the sides, though that's not the right method. It's not always best to remove tonsil stones whenever they appear. It's better to have surgery to prevent pits from forming. The stones can be dislodged by coughing or with effort. To prevent recurrence, diligently use gargles.
You rinse it all the way there.
We teach you how to manage it, but gargles often don't work. Surgery is usually necessary. In the past, they would just remove the tonsils. But since they form in pits, you only need to seal the pits. We use an electric current to close the entrance. This way, there's minimal bleeding and pain. It's done under local anesthesia. Once the holes are sealed, they usually don't recur. However, if inflammation occurs, pits can form again. There's also the lower pole where the tonsils are, which is visible to the eye, known as the tonsil sinus. It's hard to remove stones there without general anesthesia because it's too gag-inducing. If stones are there, they can't be removed. If you have both tonsil stones and recurrent tonjones and had a tonsillectomy might be needed. If you rarely have tonsillitis and only have stones from past issues and you don't want painful, scary surgery, you can try just cauterizing that spot.
I had my tonsils removed 2 years ago, and I'm very satisfied. I used to get tonsillitis a lot. But why didn't I get tonsil stones, despite frequent tonsillitis?
It's not unusual to not know. When we remove tonsils from adults like this, after removal, if you squeeze them, you'll see
If you're getting a tonsillectomy, stones may be inside.
they're usually there.
I hadn't noticed, but they might be there.
Yes, possible.
What you need to do to avoid stones is
Prevent inflammation.
It's not easy.
Avoid colds by boosting immunity, sleeping well, reducing stress, and drinking water.
Control humidity well.
It's hard to stick to. And if you've had them before, do gargles.
Reach the tonsils, not just your mouth.
There's a proper way to gargle. We should show you that next time. We'll make a video about it. Thank you.
If you've watched,
Like a threat.
did you enjoy the video? We have more fun and interesting videos ready here.
Hit subscribe to keep enjoying such videos.
So you please subscribe.
Subscribe.
Hey, why are we so bad at this?
The hearing, still bad.
I'll wait, help.